Well, proof that enterovirus D68 is spreading here in Michigan. 25 people have now tested positive for the disease, and at least one of those patients, a child, has developed paralysis. 7 Action News reporter Ross Jones just spoke with an emergency room physician. This was at Providence, and joins us with the latest. Ross.
Glenda, good evening. There is no reason to panic because this disease can easily be treated, but doctors say they are seeing more of it, and indeed, it is on the rise. The number of confirmed cases of enterovirus is climbing here in Michigan and across the country. Today, the state's Department of Community Health confirmed that 25 people have tested positive for the virus known as EVD68. About 10 days ago, there were only 3 confirmed cases.
This strain, this enterovirus, is causing a lot of kids with respiratory symptoms that are pretty significant.
Dr. Kevin Monfett is an emergency room physician at Southfield's Providence Hospital.
It seems to be affecting the kids with asthma much worse than other children, but it's making other children who don't have asthma come in and looking like they have asthma.
According to state officials, one case of the virus infected a child less than 1 year old in Washtenaw County who developed lower extremity paralysis. Dr. Monfett says it's a rare but real symptom.
There's a possibility that some viruses, and this one being one of them, can get into the spinal canal and cause some paralysis with some motor neurons. It's very rare, but it happens with multiple viruses every year.
And Monfett expects the number of cases here in Michigan and nationwide to climb, mostly because more doctors will be testing for it. While there's no antibiotic to cure the virus, it can be treated.
We're treating them symptomatically. If they're coming in with shortness of breath, difficulty breathing, we're treating their breathing problems. If it's fevers, we're treating their fevers. But treating the patient's symptoms more than the disease process itself.
And when it comes to trying to prevent this, Dr. Monfett gives that age-old advice we have all heard before but probably don't put into practice enough. Wash your hands, disinfect your home, and anything your kids might come into contact with, make sure you clean that too. Outside of Providence Hospital in Southfield, I'm Ross Jones, 7 Action News.
Thank you, Ross.